Okay, so let's talk about creatinine. So creatinine we use quite a lot in veterinary medicine, and we think of it mainly when we're looking at our renal or our kidney patients. So creatinine is found in skeletal muscle, and it's formed from creatine as part of muscle metabolism. And creatinine reflects our total muscle mass within the body because of how it gets there. It gets there from the breakdown of muscle. So if we have a greyhound, for example, who is very muscly and they are working, they have a higher muscle metabolism because they are using those muscles and therefore releasing more creatinine into the bloodstream on a day-to-day basis. So if you were to test a greyhound, it may be normal for them to have a higher level of creatinine within their bloodstream simply because they're using their muscles that bit more, and that's where creatinine comes from. But then on the flip side, think of our cats who may be quite underweight and have maybe lost quite a lot of muscle mass with your chronic kidney disease or any other chronic disease, for example. So if you have a cat or a dog with a low muscle mass, that creatinine should sit lower as well because it reflects the amount of our total muscle mass of our body. So if you have an underweight cat or a patient with a low muscle mass, but their kidney values are within the normal range, that's abnormal because their creatinine shouldn't be within the normal range if they have a low muscle mass. So in those patients, we need to consider whether that patient could have kidney disease and actually that creatinine is elevated for that patient. So it's really important to look at the muscle mass and the bodily condition score of each patient when we're evaluating things like creatinine.